I want to talk to you about why urine infection in women is very common and what you can do to prevent it. The urethra, the tube that takes urine out of the bladder into the outside world, is a lot shorter in women compared to men. This means that bacteria can easily get into the bladder and, if not dealt with appropriately, can get up the tubes called the ureter that go from the bladder to the kidneys, causing kidney infections. Firstly, let's talk about some of the symptoms of a urinary tract infection. So this includes increased frequency of urination, burning or stinging when passing urine, feeling like you're not able to completely empty your bladder. And if it becomes a bit more serious, you may also develop fever, you may develop pain in your sides or your lower back region, which may be a sign that an infection has gone upwards from your bladder into your kidneys. The things that can increase the risk of a urine infection in women are not keeping yourself well hydrated. It is generally recommended to be drinking between 1.5 liters to 2 liters of water per day. Being constipated increases the likelihood of overgrowth of bacteria that can cause urine infection, but also prevents the bladder from being able to fully empty itself. Sexual intercourse can increase the risk of urine infection in women. This is because bacteria can easily be pushed into the urethra and then into the bladder. When cleaning yourself, wiping from back to front can increase the risk of bacteria getting into the urethra and therefore causing a urinary tract infection. Let's talk about what you can do to reduce your risk of a urinary tract infection. Making sure you keep yourself well hydrated, ensuring you're drinking at least 1.5 to 2 liters of water per day. Drinking cranberry juice can also reduce your risk of a urinary tract infection as the pre-made juice, or you can get cranberry tablets that you can dilute in water. Ensuring that you urinate immediately after sexual intercourse can reduce your risk of urinary tract infection as it sweeps away any bacteria that may have entered the urethra. Preventing constipation, ensuring that you're having lots of fluid, lots of fruits, and lots of fiber. When cleaning yourself, wiping from front to back can reduce the risk of urinary tract infection, taking bacteria away from the urethra. It is also advisable to avoid using female diaphragm as a means of birth control. Avoiding the use of feminine hygiene products or scented douches can also reduce your risk of a urinary tract infection. Now, if you're developing symptoms of a urinary tract infection and it's relatively mild, such as increased frequency of urination or slight burning or stinging when passing urine, you may be able to relieve your symptoms by increasing the amount of fluid that you're drinking and drinking more cranberry juice. However, if you develop a fever or pain in your sides or loins, suggesting that the infection may be going up to your kidneys, you should always seek medical advice. Contact your doctor as taking antibiotics at this stage may be quite critical to prevent a life threatening infection, a more severe infection that may spread to your entire body and cause sepsis.